a Sapphire Running Zone podcast.
Hi everyone, this is Tim from the Sapphire Running Zone, and welcome to the first in a series of podcasts where we're looking at injuries. Plague of many of our running careers. For some people, they get none. And what we're going to do in this series is to look at the common types, how to avoid them, how to deal with them, and hopefully give you some guidance on keeping away from the physios. Anyway, talking of physios, delighted to welcome Gary Bissell, our resident physio, to join me today and on quite a few others. Gary is a leading physio, practices all over the country, and is a former very quick runner, now runs for fun. So as I said, on today's, we are going to look at what's it like when you first start running. What should you be looking out for? Inevitably, you will get a niggle at some point, but we're going to look at the stress that running puts on the body, how the body adapts to that stress, and what to do if some of that stress does cause you to have an injury that does need a little bit of attention. So welcome, Gary. Great to have you here. Tell us a little bit more about yourself and your running career today.
Thank you very much, Tim. Well, I'm a chartered physiotherapist, over 34 years now in the profession. I work with Pro Physio and Pro Health, which we work nationally, locally in the Cheshire region, but nationally also as an organisation. From a running perspective, we treat plenty of runners, many club runners. I've also been involved in the London Marathon physio for a number of years, which was quite an experience. As a runner myself, I'm a middle distance runner of old, run for fun and pleasure and everything like that now for wellness and happiness and all that.
So Gary, just talk us through, running as stress. What does running do to the body? And, is it good for you to get that little bit of stress?
Yeah, stress is the way that runners will adapt, and the body. If you're going to be taking on a running event, you will be putting in training. That training is a stress. It's about applying the appropriate stress to get that good adaptation. So if the stress load is too much, you start to get niggles and potentially injuries. If the stress is right, you'll progress and get fitter, and you'll adapt to that running. Your running will feel a little bit easier on your next run and the following week, and so on and so forth. And so stress will be affecting the muscles, the tendons, the ligaments, the cardiovascular system. So the cardiovascular system for an endurance athlete, you'll be improving the blood volume. You'll be improving the ability of the heart to pump that blood around the body more easily. So stress is important, but the key is getting that right level of stress.
Right. And some elements obviously adapt at different speeds, don't they? So your cardiovascular fitness can improve quite significantly, quite quickly, can't it? But presumably a lot of what is going on in your body doesn't adapt at the same time.
Yeah, it's a really good point, that, Tim. The cardiovascular system does improve pretty quickly. And again, in novice runners, they see that as as a great signal to push on quickly and things like that, which is good from the cardiovascular perspective. However, we just need to be careful with that load. The training volume isn't too much too quickly, because the tendons, the bones, and the ligaments all adapt a little bit slower than that. Muscles are reasonably quick too, within weeks of a training stimulus, and bone is often months. Bone and tendons as well take longer. So people who are undergoing a program, their muscles will adapt quicker, and they may increase the load and thinking, yeah, happy days, training's going well. But if they increase it in a not a sensible way, then they may end up with starting to get some tendon soreness. Typically in runners, the typical running tendon injuries are the Achilles tendon, which I'm sure most people will have heard of, and also the tendon below the knee, which is the patellar tendon. So those are common runners' injuries, but often that's because the runner, the athlete, is increased too quickly, and I go back to my old running days when I was a track runner, and we used to sort of increase volume kind of by very small increments. And there's a famous book by a guy called Tim Noakes, and it was like the 10% rule. So the volume would only go by up 10% a week, and then even every third week you bring that volume back down a little bit, because otherwise you could be increasing too quickly. You maybe think you're adapting well to the load, and maybe the muscles and the cardiovascular system have made that adaptation, but maybe the tendons haven't. And then all of a sudden there's a lag from that load, and then you start to get tendon soreness, and then you're in a cycle of needing to adapt, to drop your training down to help yourself carry on again.
So I think it's hard for people sometimes to understand why training plans, which obviously are should be the basis of all training programs, is you got a decent training plan, and they all should include extensive rest periods. And I think a lot of people are just, well, I feel all right. I feel fine. I know I could go out running again tomorrow. Just talk us through the need for that rest day. And it might be, 3 rest days a week for some people, particularly at the beginning. Just talk us through why it's so important to have that rest period.
Yeah, it's right, Tim. And when you consider rest, training is the stimulus, as we've said. But to grow any of those tissues, the muscles, the bones, to become fitter in essence, to tolerate the stresses of running, that rest phase is where that happens. And if you go train without any rest interspersed into that, so a day of rest, the following day after a large session is good, because that's when the growth occurs. And as you say, typically, a novice runner may have 2 or 3 days rest in that program. If they're on so training for a marathon, they're on a three cycle training period, maybe an intermediate, maybe on a 5-day, but I would definitely kind of have a couple of days rest, but maybe more, as you say, because that's where the growth occurs. And rest really allows those adaptations from that training stimulus to get better. But then you can look at kind of, rest in the sense of, are you just taking the day off? Are you busy with life? If you're busy with life, you maybe consider, is that really, really good rest? And then another big part of rest is sleep. I think most people are aware of kind of the metrics on sleep these days, and to get a good night's sleep. There's been some interesting research over the last year or so in sleep metrics and stress fractures, that people who don't get 7 hours of sleep are significantly increasing their risk of bone injury. Because when you get good restorative sleep, the bone adapts from the stress that you've put on. The hormones, the human growth hormones, are released in that deep sleep phase. So when you sleep well, i.e. rest well, you recover better, and then you're more able to train the next day, and you've made those adaptations from that training block that you've put in.
That's really interesting. So it's not really rest at all, is it? Things are going on. It's not as if you're seeing no benefit at all. You're actually training, but actually it's when you're resting that the benefits of that training really start to happen.
Absolutely. It depends what the training's being, but everything is adapting. So the muscles, the tendons, the muscle fibers are getting stronger, more resilient. They're getting more pliable. The tendons are able to tolerate more load from the running. As people are aware, running is 2 to 3 to 10 times their own body weight. The efficient guys are at the 2 to 3 times. The less efficient of us are more like the 10 times. The body has to learn to take those loads, but it's adapting to that. So the tendons are getting stronger. The muscles are getting stronger. The neuromuscular system's becoming more coordinated. So your running becomes easy because you become more fluid at that skill. So yeah, things are going on all the time. Muscularly, you're increasing your red blood cells so you can carry more oxygen, which is really important if you've got an endurance event like a marathon or a triathlon or a long, even a half marathon. Very important. Your blood volume increases again, allowing you to carry that oxygen around more readily. So all those things are going on whilst you're resting. So even though it feels a day of leisure, good things are happening in the body.
Interesting. And what would you say to people who who just can't rest and actually go, well, I'll use the rest day for bit of cross training. I'll go for a swim, or I'll have a little session in the gym, some conditioning. I mean, obviously cross training is really important, but again, one of the principles of training is this specificity. So if you're going to train for a distance event, then it's all about the running. Where do you sit with the cross training and cross training on rest days?
If they've got no niggles or no injuries, again, if their running age is quite low, i.e. they haven't really done much running, then sometimes actually when you're quite right to bring in the word specificity. But if you're trying to build up volume, then maybe you could intersperse one of those days as maybe a bike session or a cross trainer or a swim session. Because, for example, the stimulus is still on the cardiovascular system if it's an endurance session on the bike to grow and develop. You're not developing the specificity, as you rightly said, in the muscles and the tendons, because it's a different movement and action. But as long as some of that is there, and again, from the context of early on in the program, I think that's sensible to listen to your body. So if your training is going really well, then you probably feel like you're okay to do that run. And that's probably okay as long as you abide by those principles of sensible progression, not too much, not too fast. Then you're probably okay to do that run. But if you're feeling maybe there's some increasing soreness in the muscles, maybe some DOMs, then maybe if it was due to be a training day, then maybe a cross training day. However, coming back to the rest day per se, would you put that session in on a rest day per se? I'd be careful if you're on a 3 or 5 day kind of program, that you're not increasing too much too rapidly too soon. If you were doing a 5 to 10 minute flush, a low grade easy spin on the bike for 10, 15 minutes, zone 1, that may flush the muscles and help you to recover. But if you get carried away a little bit and you start to make that become a session that starts to morph into a higher zone, starting to get into the zone 3, starting to move into lactate thresholds for those who are aware, i.e. when they start to get more breathless, then you really aren't resting and you really aren't recovering, and you really will start to take away from any adaptions from that session you did the day before.
Right. So it really, up to a point, does depend on what level you're at, doesn't it? If you're an athlete who's aiming for a sub 3 hour marathon, you should probably be training 6 days a week. Your rest day is obviously critically important, but you could do some light work in the gym potentially. But if you're a beginner starting out on a 16-week plan, you can substitute running day for a cross training day, but your rest days really are sacrosanct, aren't they?
They absolutely are, and I think there's a big word in sport per se, but also in running, and a couple of words: load management. It's where your running age is. If you've only done a 5K before and you're moving to a marathon, you're really got a low running gauge, and you should be very careful in these build-ups, particularly in the first third of that 16-week program, that you don't increase those stresses too much too rapidly too quickly, and you really do take those rest days, because you may think you're progressing well, and then all of a sudden, third of the way through that program, you're starting to get a niggle and an injury. So yeah, I agree. They are sacrosanct to have that rest and be respectful of where you are in this journey. And as physios and people like yourself, Tim, you're very privileged to talk to runners who are doing these things. But it's always better if they get less niggles and less injuries in anything that sort of affects that journey going through. So we always encourage that appropriate rest and that appropriate load management from the start.
So let's just talk through a beginner, early days, start to feel a few little niggles, bit of, is it pain? Is it a niggle? Difficult to say. What's the sort of that line between pain versus injury? And talk us through DOMs, which you mentioned before, and just explain to everyone exactly what that is.
Yes, so let's bring us to DOMs, and sorry for the acronym. It's known as delayed onset muscle soreness, and what that is in essence when most people have experienced when they when they've done some slightly unaccustomed activity. So they've been on maybe a long hill walk with a family, and then maybe the next day they can feel their calves and their muscles aching a little bit. That is DOMS, and that's typically reaches its peak 24 to 48 hours kind of after that stimulus of the long walk. Or, when you've got a new training program, if it's unaccustomed and you're building, then that DOMS maker, and to some extent that DOMS is normal. But again, you may want to quantify, is it really heavy DOMS? Is it like, if you were saying you out of a 0 to 10 scale, your DOMS is a 2, well, you probably adapting really nicely, and a little bit of ache in that muscle. And again, if it's generalized, is a good thing, because that's good adaptation. But that rest day will allow that adaptation to occur. If your DOMS is really high, even if it's generalized really high, if you say in the whole of your legs you're kind of getting like an 8 out of 10, maybe it's a sign that you went a little bit hard on that session. It may not be an injury, but just modify your load a little bit, bring the intensity down. You may have gone a little bit quick. When we're talking training, we're often for marathons, we're talking like that polarized 80-20. 80% should be really steady, and that steady is often zone 1 to zone 2. If your DOMS is going up high in your training on that easy stuff, maybe that easy isn't as easy as you think you did go. It should be easier. Now, if it starts to become more focal, i.e. you're starting to get like a localized, maybe pain is the word, into a joint or a tendon, and it's maybe, unilateral or something, that's something to monitor with a little bit more, awareness is probably a better word, awareness. Now, most people have little sensations that come and go. And if it comes and goes within a few hours or half a day, absolutely no problem, but just still monitor it. Elite athletes use reporting monitoring tools every day. They wake up, how does it feel in the joints? How does it feel in the muscles? And I think us as more beginner athletes can do the same too. So if you feel a little bit of something in your knee, on your right knee that you don't feel on the left, monitor that. If it doesn't go within half a day, just analyze your training. Did it go above that 10%? And if it hasn't gone within a day or two, maybe you should be reaching out to your coach, your training plan, looking, did I follow that training plan appropriately? Have I gone a little bit too much? Do I need to bring it back? And if it's still there, or if it's becoming more troublesome and quite painful, then we need to, maybe reach out to the medical professional. Now, we also look at that pain sometimes if it's, red flags for us, if it's a very strong pain, if it's altering your running pattern, that's significant, or if it's a constant pain. So people, when they're off their feet and they're feeling like a throbbing pain in their shin, maybe we need to be careful of that, because, we don't want the risk of a bony injury, such as a stress fracture. And that's important. So again, that's why, being careful with your load progression, and being careful, as we've already said, with the rest days, and then just listening to your body for what is, in essence, a little adaptation from the DOMS, but again, just modify your load accordingly to maybe some more slightly stronger sensations, which may be in joints or bones, that we watch with caution. And again, if it's starting to become constant pain, be careful, particularly if it's also affecting your running form.
Is it true that if you do have an issue, that stopping completely isn't always the best approach?
Absolutely. And Tim, some people see physios and medical professionals, they're going to tell me to stop running. And actually, me as an old runner, that's and a person who still loves to run, that's what I don't want to hear at all. And it's often that, I've used this word a bit now, load modification. So, you as the runner, with your training program and maybe with your coach, can modify that load. Us as physios, that's what we do too. So say you're on a 5-day program, often we'll kind of, if you've got something in there, we might reduce it. We might say, let's drop it down to 3 days. Let's change the pace. And while we put in, an appropriate strengthening program, maybe that's required, to look at things. But the last thing we want to do, if we can help it, is stop people running, because often, the problems still exist, because, most running injuries are overuse. So if we can bring that down a little bit, modify that load, often we get that recovery, and we'll get the adaptation in the tendon and the muscle that we want to by adjusting those loads and putting some specificity into, maybe some calf training, capacity of the calf, or strengthening up the glutes, or whatever we find on our assessment. But a lot of times we really do not need to stop that athlete running. And the event is important, and we can, if we catch it early enough, we can often get that athlete to the start line, that runner to the start line in good shape.
So this is all about, as much as possible, is about consistency, isn't it? Just talk us through that and how that helps, build that appropriate level of stress.
Yeah, consistency is really important. You've acknowledged, a 16-week, 18-week training program. We've acknowledged maybe where a runner is at in their journey, their running age, as we call it. Have they ran much before? But consistency is important, and I think if you've got a really young running age, the knowledge of your body, first of all, and how it feels with training is also young. So learning to feel your body, listening to your body is important. But if we go steady with that program, particularly that first third of it, and listen to it, then often we make the second third and the final third of the training program. So if we can keep going through that, but get to the end of the training program, that's fantastic. Things may happen. I don't know, a cold or a little niggle or a family event. I think you can look at the program. If you hit 80 to 90%, 90% of the program, you're going to be in pretty good shape for your event. I think consistency is important, but not at the expense of trying to push this. I must get all the sessions in the week. But I think if we look at just sort of going appropriate loading and not worrying if you missed the odd session, that's sensible. But don't also try and catch that session up because you had an event on Tuesday, which meant that then I'm going to try and backload the week. I think if you apply those principles, I think you'll be safer.
Yeah, I think one of the interesting things when I talk to beginner runners, Gary, is what is it supposed to feel like when I start running? And we touched on the point about, is it niggle or is it pain? What's it supposed to be like? Should it be a painless, niggle-free process, or am I expected to feel something as the stress levels are adapted by the bodies? What are your thoughts on that?
That's a really good question, and I suppose when we talk about sensations and pain as a concept, we're all individuals. So there's an individual journey as well as the sports science journey and the medicalization of it. And I do think you're right. There is an element that you'll feel aches and things if you're not used to training, and that's normal. I think if you get your training levels right, I think a little bit of a, in your in your own reference point, some aches that are generalized in the muscles of a 2 or 3 out of 10 to your scale, your own individual scale, are probably quite normal. And as long as those have settled before the next training session, I think that's pretty good. So again, that's where the adequate rest kicks in. I think, again, going back to a polarized approach for a training novice runner, 80% of those miles are meant to be steady. Zone 1, zone 2. So, you're not going to get huge, strong DOMs if you're in those zones, but you will get some aches and some adaptations from that as you work through them. But I would say you're looking at, hopefully those have recovered by the time you do your next session. If it's a build of that DOMS, one day it's a 2, and by the next training session it's now a 4. and the next day it's maybe a 6, the next training session is 6, maybe we do need to look at that load and that modification, because we don't want to risk injury. So you might say, again, if they've got a very young running age, should we put a cross training session in today? Because maybe we can stimulate the cardiovascular system, but just help those muscles recover a little bit quicker before the next session. I also think that the aspect of the long run is an interesting concept, because in those, maybe three runs or 5 runs, one of those runs is going to be a progressive build run. And even though it's often classed as an easy pace, as you become a more seasoned runner, you'll start to do what you call marathon-based sessions, more kind of hitting into that kind of threshold zone. But often as the novice runner, you're just looking to build distance. But that long run is still, even though it's classed as an easy pace, because it's long, it's still a tough session, because you're getting there. So you would expect, again, to have some soreness and some stiffness the day after, but it's how you recover from that which is important. So like I say, if it's a building sensation, that's okay. If it's recovering in the next 24 to 48 hours, you're probably then ready for the next session quite well adapted.
Excellent. No, that was really useful, Gary. I think the message there for everyone is, it's very normal to feel some niggles, some pains when you're starting out, but if it's recurring and it's consistent, then it needs to be looked at for sure. Really appreciate you joining me today, and we will look forward to speaking to you again very shortly.
Thank you very much.
Thanks for listening to this Sapphire Running Zone podcast. Keep checking back, as we have lots more podcasts coming soon.